Deputy Micheál Martin.
Thank you very much indeed. Ceann Comhairle Taoiseach, by the end of this year, we could witness over 100,000 people having been on trolleys throughout the year. And so far, there has been over 10,000 people over 75 years of age waiting for more than 24 hours in our country's emergency departments. We've lost so far this year about 136,000 bed days through delayed discharges, and that's only in the first 10 months of the year. And we know the extraordinary impact this has on patients and on people, and indeed on mortality rates in our hospitals and worsening illnesses that people have as they present to emergency departments. And that's not to mention the huge problem in terms of people waiting for outpatient department appointments, over 500,000, 16,000 children waiting for more than a year, for example, for an appointment in the 3 Dublin hospitals alone. Yesterday we had 449 patients on trolleys. There's 508 patients on trolleys today. It also places enormous pressure on the staff of our emergency departments and on our hospitals. And a document published yesterday, leaked to the papers this morning in the Irish Times, lessons to be learned from the winter crisis of 2017-2018. One of its most basic observations is the need to plan in advance and to have all winter plans completed by the end of July of 2018. We're now in November and we still haven't the winter plan announced. And what we've also learned through a leaked report via Martin Wall, who makes up for the absence of transparency within the government and the Department of Health on health issues by revealing confidential letters on a regular basis. But he revealed in a confidential letter from the department to the HSE that 50 million that was to be spent on beds last year, on additional beds, didn't get spent, but instead has been used to deal with the excessive spending of 2017. I think that's incredible, Taoiseach, and I think it strains government credibility on the health issue, and particularly in terms of emergency departments, to the very, very limit when it now emerges that despite all of the announcements, and we have a series of announcements from Minister Harris throughout the year that money would be made available for extra beds, extra capacity, we now learn that that money was diverted and was never spent on extra capacity, either in beds. We know from many sources, the most recent being the former HSE Director, Tony O'Brien, that the consultant crisis, the inability to recruit quality consultants now, the paucity of applicants for consultant posts is adding to that crisis. So the need for a winter plan is basic. It's to enable people to have time to build up both physical capacity in terms of beds and also recruitment of staff in terms of the hospitals. Now, that didn't happen last year. It came too late, and the money was not spent optimally, and as a result we had a crisis reaction which was very poor and quite disgraceful. We're now going to potentially have the same this year through a lack of planning. Can you explain to me, Taoiseach, why that extra 50 million that was allocated last year wasn't spent on additional beds and on additional capacity? And can you indicate to me when the plan for the forthcoming winter period is to be announced by the government?
Taoiseach, please. Thanks, Taoiseach. Deputy Martin, you have a minute now.
Taoiseach, the bottom line is that the small number of beds that were promised for 2018 were not simply delivered by the government. That modular unit in Clonmel has been promised for over 2 years now, maybe longer, and still hasn't been delivered. The Minister yesterday couldn't give specifics in terms of additional bed capacity for 2019. He used the phrase early in 2019. Now, to be fair to your predecessor, Enda Kenny, he gave a whole new meaning to the definition of early. And normally it meant, at the very earliest, the middle of the following year, if not the end of the following year. So forgive me for being somewhat sceptical when ministers talk about early next year. That invariably means the end of next year and sometimes drifts into early the following year. Problem is, Taoiseach, delivery and the absence of delivery. And too many people, and too many elderly people, are suffering far too much in our emergency departments because of the absence of planning. Now, the lessons that were supposed to be learned from last year was that winter plans were supposed to be concluded by the end of July. That again has not happened this year.
Thank you,
And we're
Deputy.
facing into another winter crisis in our emergency departments with a chronic absence of any planning and therefore a lack of any confidence in the capacity of our health service to deal with the issues that will undoubtedly emerge in the coming months.
Taoiseach.